Okay.
Here we go.
So the next one, you're going to do the patella joint play. And so you want to make sure the quads relax, otherwise you're not going to get anything. But in the book, it kind of says to imagine the patella if it had like 4 quadrants. So when you're moving it around, you're going to compare it bilaterally, and you're seeing for any irregular motion or hypo or hypermobility. So regular medial glide would be about half of the patella, so 2 quadrants, and then laterally it would be about 1 quadrant, maybe a little more, depending on their flexibility. But this will be testing for the ligaments that attach to it to see if there's any injuries to them. If the hypomobile on the medial side, it could be tightness of the lateral retinaculum or IT band. If it's hypermobile on the medial side, it can mean laxity of the lateral restraints. And then when you're doing it to the lateral side, if it's hypomobile, there'll be tightness of the medial restraints or the patellofemoral ligament. And then the hypermobile of the lateral side, it'll be laxity of the medial restraints. And then there's also the patellar tilt, which is kind of hard, I think, but you kind of have to like go under and then like lift it up on both sides. And you're pretty much, these tests are just, they're pretty much range of motion of the patella in a way, so you're going to compare bilaterally to see for any ligament injuries.
And both of these tests are just to give you an idea of if that patella is sitting correctly, okay? Because some of you are going to find that some of your classmates, their patellas may be rotated or they may be tilted, all right? And you'll be able to figure that out once you start palpating here, okay? All right, here's what we're going to do.